Have you ever been asked to tip your Botox or laser provider? Hi, I'm Dr. Kate D, and today I'm going to talk a little bit about tipping and tip screens at med spas. There's a video that Helen Zhao put out recently that complains that toxic tip culture in the US has spread to med spas. And in it, she makes some really great points about toxic tip culture, but I think the situation's even worse than she's pointing out, and I'm going to tell you why.
I recently had a laser facial done at the national med spa chain Skin Laundry with a registered nurse. At the end, I was asked to tip up to $30 for the service valued at $275.
So first of all, she describes going into a national chain of med spas. She was in California. This national chain was called Skin Laundry. And at that place, they hire nurses to perform laser procedures and other medical treatments. Now, the company posts job openings in California saying that it pays nurses $28 an hour plus tips and commission. Now, that's a really low wage for this kind of service. It'd be low for nurses kind of anywhere, but especially low in the med spa space. So what's the result of that? I mean, this company is using tips so that they can underpay their nurses. And in addition, the structure with a very low hourly wage and a high dependence on tips and commission, that incentivizes the nurses, potentially anyway, to sell you services that you do not need or want, okay? And then Helen in the video describes how this happened to her at Skin Laundry. Now, upselling, that is legal in business, but in medicine, it's really unethical. Okay, so let's dive into that. Tip screens are everywhere. Takeout, you're now paying a tip. Fast casual restaurants, you're paying a tip. Even just counter sales where you go up and you literally just pay at the register for, a thing at the counter, whether it's lip balm or whatever, a tip screen tends to pop up these days. Now, ever since COVID, I think this has become the norm. And you now have to decide whether you're going to tip all these workers or not. They're really appealing to our sense of duty, like, people don't make enough money. That's okay, right? But don't you think that these places should be paying their workers adequately to start with? My biggest pet peeve about the toxic tip culture now is that those tip screens, whether it gives you percentage options like 18, 20, 22%, that percentage is based on the post-tax amount of the bill, okay? And I don't know about where you live, but where I live in Seattle, our sales tax is already 10.25%. And we're now being asked to tip 20% on top of tax. Okay, that's my pet peeve. But anyway, what about med spas and other cosmetic medical practices? Why are they doing this? Well, I think most of them, it's a money grab, mostly from unethical spas that, because this shady practice predates the recent tip screen epidemic, which I would date to COVID in 2020. So why is it illegal or unethical or both at med spas? Well, in general, money is not supposed to influence medical treatment, okay? So if you're going to have heart surgery and you bring your doctor, an extra big tip, does that bump you up in line above somebody who maybe needs it more but doesn't have as much money? That kind of thing, right? So there are a lot of laws to prevent money from influencing medical procedures. But what about elective procedures? Well, there's two big problems with it. So first of all, tipping may be considered fee splitting by the medical boards, and that's illegal. And then if you ask the AMA, they would say it's completely unethical. And I'll read from the AMA Code of Ethics here. It states that physicians to whom a patient offers a gift should not allow the gift or offer of a gift to influence this patient's medical care. Okay, could a large tip be construed as a gift? Absolutely. And that has the potential to influence the patient's care. But hey, the AMA doesn't know specifically anything about med spas, right? So we do have tipping in med spas because many med spas have non-medical treatments like facials and dermaplating, okay? So those passive tip screens will pop up, but they should only pop up for the non-medical treatments. Is that what happens? Well, I think there is a little bit of a businessy software component to this problem, okay? Because all these different med spas are using different kinds of software, and some just have an automatic tip screen that you have to get rid of for the medical ones and keep for the non-medical ones. In my opinion, they shouldn't be using that kind of simple software because that will unduly influence people to tip on medical procedures, and they shouldn't be. So at my med spa, we use a pretty complicated spa software that actually allows us to control that. And so it should only offer a tip screen for facials and things like that. Now, I will tell you that we have gone through iterations of this software where it automatically upgrades and it affects a lot of the defaults, and suddenly the tip screens change. I have had it happen where I've been scrambling around to get rid of the tip screen for the medical procedures because something got undone. But in general, these offices should not be asking for tips on Botox or laser, okay? So hopefully it was an honest mistake, but my guess is that most of the time these places are just looking to increase their bottom line. So it's a little bit murky. Is it completely illegal or merely unethical? Does that matter? I mean, it should definitely matter to the doctor in charge. And of course, every med spa should have a doctor in charge. They're supposed to have a medical director. I can tell you, I really care because the unethical practice of medicine can be grounds to lose your license. Okay. So for most doctors, it's the equivalent of being illegal, even if the lawyers might quibble about whether it's fee splitting or not. But what if your provider is not a doctor? What if they don't even have any license at all? They have no license to lose, so they don't care. Adding a tip screen could boost their bottom line by 20%. So beware of the tip screen in your medical spa. If you had a facial, it's fair game. But if you just had Botox or laser and you see a tip screen, don't be afraid to pass. And let the manager know it could possibly have been a mistake. So if you've had this happen to you, drop me a line and tell me about it. Your story could end up featured in a future episode of Med Spa Confidential. And until next week, thanks so much for being here. So if you've been listening to the show, you know I've got stories for days about what goes on in med spas. I finally put them all in a book. It's called Med Spa Mayhem. I wrote it because I got tired of hearing about people getting hurt by providers who have no business holding a syringe. You'll read about real patients, real nightmares, but more importantly, you'll know exactly what to look for when you walk into any med spa and what questions to ask. It's part expose, part survival guide, and it might just save your life. Med Spa Mayhem will leave you informed, entertained, and a little shocked at what's really going on behind the business of the aesthetics industry. The link is in the episode description. Read it before you book your next appointment, because beauty should never come at the cost of your safety. Thanks for listening. If you found this helpful, do me a favor and share it with a friend who's considering any aesthetic treatments. Subscribe so you don't miss the next one, and drop a comment telling me your biggest takeaway. I actually read them all. Let's keep each other safe and elevate the standards in the med spa industry.